Prof, thank you so much for your time. This sharp rise in infections, what is it telling you about the character of the third wave for Gauteng?
Thanks for having me, Sally. So indeed, the numbers are troubling. We are in the middle of a spike. It's a serious situation. As you correctly pointed out, the number of cases reported last night is a record high in Gauteng for the entire pandemic. Of course, there's always fluctuations. It doesn't mean that it's going to be like that all the time, but it's certainly worrisome that there's been a record in the number of cases. So what we see right now, we look at the numbers, obviously, on a daily basis. We study them very carefully, these and other indexes. So what we see right now is that the numbers seem to be progressing solidly along the prediction for the worst-case scenario. So if you look at the projections and the mathematics that are provided by the modeling, you see that the numbers actually are very close to that worst-case scenario. So what does that mean? It means that we're solidly going towards a peak, which will probably happen somewhere between the last week of June or the beginning or the first week of July, with about 65,000 to 75,000 active cases. And as you correctly point out, that will certainly overshoot what we saw during the second wave.
And is it possible to, and this is a rather grim question, but to predict how many deaths we might experience?
Right now, it's early to do so because the curve of mortality always lags behind the number of cases, hospitalizations, and so on and so forth. So what we see right now is too early to conclude. Now, it is very important to note that the vaccination campaign is aimed at vulnerable populations that are most likely to contract severe illness. And as the vaccination campaign progresses, we expect, of course, the numbers to be lower. But, of course, right now what we see is that also the number of people vaccinated is certainly not high enough to expect a significant impact on mortality. That being said, it's extremely essential that those above 60 go and get vaccinated. I mean, this is a message that is being sent out by the province and policymakers.
Is a sharp rise more dangerous in terms of numbers than a slow rise? I mean, I was looking at the graphs, and they're almost at 90 degrees. That's how quickly they're rising here in Gauteng. Does that mean that our hospitals, already under severe pressure, are going to feel the brunt really badly, worse than we'd hoped?
As soon as the first signs of the spike appeared in the data, which was Wednesday, Thursday, we certainly sounded the alarm among stakeholders, including the CEO of hospitals, and we provided the first projections to them in light of this spike. And of course, as you correctly point out, the pressure is tremendous. Now, what is different now compared to the second wave is that our mobility is at the highest point since the advent of the pandemic. Okay, so when you look at the mobility reports, the different types of mobilities, the historical trend was certainly at a very high level. And at the same time, the level of adherence to social distancing, especially when we move in taxis and we commute, seems to have degraded. And that's a very big source of concern. That's driving the numbers. And as a result of that, the message is extremely clear and extremely concrete and very well motivated, is that now it is the time to adhere to social distancing measures, such as wearing masks and sanitizing. That's really what we have to do at the moment.
So you say we're moving around a lot and we're not adhering to the measures. We've spoken, and we haven't spoken of this for months, but remember there was a time when there was a discussion about, and I think we did it in the last few waves, a sort of a circuit breaker period, a 2-week mini lockdown where everyone just shelters in place, basically, to try and cut the infections. Is that the sort of thing that is still on the array of options for government to look at? Or has that been proven not to be very effective and therefore not something we would consider?
That approach has been applied in a number of countries in a number of situations. Certainly it does work to some degree, and it has been studied by our team. Now, what is essential is this week. This week is absolutely essential because we need to understand what is the level of acceleration in the number of cases this week to the previous. That's what's going to give us a very good understanding of whether more severe measures will be needed. So right now we see these very large numbers. We know the numbers that will be announced today and the numbers of tomorrow. These 3 days are very critical because those are the 3 days in the epidemiological week when we get the maximum number of cases, typically, of course. So based on those 3 numbers, we will know where we're going to be going in the next few weeks.
So when I was going to say, should we be closing schools in Gauteng? Should we be actually on alert level 4 or 5? I would imagine your answer is give me 3 days to look at the numbers and what that's telling us, and then we'll have a clearer idea?
Correct. The dynamics that underlie the pandemic are basically hidden in the numbers. And the way the numbers accelerate give us an understanding on what are the forces that drive the pandemic. So what we're going to have this week, so far we see that acceleration is similar to the previous week, so it's not getting worse. The acceleration is not going faster than last week. That's obviously something we have to monitor very, very closely. And these next 3 days are going to drive that acceleration. So that is going to give us a very good understanding of where we actually stand. Also, we have to take into account the fact that level 3 measures have just been reinstated. So it takes between 1 and 2 weeks to actually see what the effect of level 3 is. So it's premature to talk about, harsher measures.
All right, thank you so much for explaining that to us so simply and so clearly. That was Professor Bruce Mellado of Wits University. He's also, of course, a member of the Gauteng Premier's Advisory Committee, telling us that the next few days are absolutely critical for Gauteng to see what the numbers are doing and whether we need tighter restrictions.